Hello, everyone. You are all welcome. Please bear with us as we await the others to join us. Um, Ahmed, Princess, and Aliu, and the others, you are all welcome. Welcome to every one of you.
Aka kawo 'yan kaya maman Muhammad ya ce wa 'yan wannan baya nan.
In a few minutes, we'll be starting. Please bear with us. Okay, this one. All right, welcome everyone. With the others, let's get to know each other. Okay, let's get to know each other. My name is Musa Al Hassan Kuroma, and I'm a student, and I'm the founder and the director of Public Health Foundation of Liberia. I'm glad to be here with you all. So like I said earlier, as we await for the others to join us, let's introduce ourselves and network. So if you are ready, just raise your hand. There's an icon there. You can just raise your hand and I'll unmute you so you can introduce yourself. All right. Okay.
Hello?
Mwangusi,
Can
yes.
you hear me?
Yes, I'm hearing you.
Yes, I'm Mwanguzi Newton from Uganda.
Nice meeting you. How's Uganda?
Uganda is good. I'm a student of public health.
That's great. Nice meeting you. I have so many Uganda friends here in Turkey.
Oh, happy meeting you. I believe we are going to share a lot out of this meeting, and please, we continuously share because we need to learn and enrich ourselves with issues concerning public health. Thank you.
Sure, nice meeting you. Anyone else? Anyone else? Is there anyone else who would like to introduce themselves? It's just, for us to know each other. All right, Dauda, you can go ahead.
Okay, I'm Dauda VCC from Liberia, and a member of Scholar Educational Network Cine. Thank you.
Nice meeting you, Dauda. How is Liberia?
Everything is okay. Praise God.
That's great. Hope you are taking some precautions because we are receiving news around that the coronavirus is resurfacing in Liberia.
Actually, sure. We are taking precaution. Okay. It is not easy, but however, everything going to be okay.
All right, nice meeting you.
Nice meeting you.
Anyone else? Okay, Ahmed. Ahmed. If you don't want to open your mic to introduce yourself, you can just do it in the chat box. Well, Center is so as the other join us. Welcome, man. We are glad to have you with us here tonight.
Can you hear me?
Yes.
Okay, great.
Could you please give us like 5 minutes for the others to join us?
Yeah, sure.
Thank you very much. All right. Thanks to every one of you for your patience. We'll send a reminder email to all those that register, and we've also reminded them in the WhatsApp group. Probably they will join us soon. So we are not going to waste time about waiting for them. Just a reminder, the meeting is being recorded. If you have problem with that, please let us know. And it is being live streamed on Facebook. If you also don't want that, please let us know. And the video will also be posted on YouTube. If you have problem with that, please also let us know. We don't want to inconvenience anyone. But if you don't have problem with it, please make sure your background is okay. If you don't have chat on, don't open your video. And if your background is noisy, please don't also unmute yourself, because it will disturb us while the training is going on. If you have any question, okay, I think I will leave that to the facilitator. She will decide when and how she will take the questions. So before we proceed, let's introduce our speaker for tonight. So like we told you yesterday, that the training is mainly about networking and meeting new people and learning about public health, the opportunities involved in public health, and how we, the young people of Africa, can help in health promotion across Africa and the world at large. So our tonight's presenter will be Ms. Favor Obasiolo. I'm sorry if I mispronounce your last name. Please correct me if there's a mistake there. So she has a BA in Public Health Policy and an associate degree in Art and Sciences. She also has a certificate in Occupational Health and Safety and Essential of Global Health. She's the founder and director of Public Health on Demand. Like yesterday, I shared a link with you guys in the WhatsApp group. You can follow her page for more update on public health issues and also as a means of networking with her. We will reshare it tonight after her presentation. And maybe she also decide to share her LinkedIn with you guys later. So as for the questions and other stuff, she will decide how she will take the questions, whether it will be through the conversation or after her presentation. That will be up to her. So please, I'm going to mute everyone. If you have a question, just raise your hand and you'll be unmuted. Please don't unmute yourself without taking permission, please. So I guess the others will join us in the middle of the conversation. Thanks to those that joined early. All right. So thanks again for listening to us. Now we would turn the floor over to our presenter so she can start with her presentation.
Hi, everyone. Good afternoon. Here in Maryland, it's 1 p.m. So good afternoon or good evening. I'm going to share my screen. Just a second. Okay, can you see my screen?
Yes, I'm seeing it.
Okay, great.
If you're using your phone, just flip your phone on the left or the right, and you will see the screen.
Okay. So today I'm going to be talking about women empowerment through public health and how women and young girls can lead in healthcare promotions across Africa. So a little bit about myself. My name is Favor Obasiolu. I was born in Nigeria, which is right there on the map, west coast of Africa. I was raised in the US. I came to America when I was 6 years old, and I went to middle school, high school, and university here in the US. And I have a degree in public health with a policy focus. And I also have a passion for global health and policy. And outside of public health, I also love fashion, and I have my own fashion styling business on my free time. So women empowerment. So what is women empowerment? So women empowerment refers to promoting women's sense of worth, their ability to determine their own choices, which is autonomy, and their right to influence social change for themselves and for others. So understanding the duality and versatility of women, understanding that we can be both leaders and change makers while also being mothers and sisters and wives at the same time, if that's what we want. And feeling like not feeling like you have to choose between being a mom, a wife, or a sister versus being the leader. You can do both of them. So that's what women empowerment is all about. Realizing that, yes, I can be a mom. Yes, I can be a wife. Yes, I can be a sister, but I can also be a leader and be in position of leadership at the same time. So here I have impact of women in healthcare. So globally, 70% of health and social workforce are women. Many of them are nurses and midwives. So I just wanted to highlight the impact that women play in the healthcare industry, which is a lot, 70%. That's 7 out of 10 people in the social workforce and health are women. So women are very important in healthcare. So gender equality. So gender equality is a basic human right, and it is also fundamental to having a peaceful and prosperous world. Globalization has begun to alter cultural attitudes around the world because of the internet, the media, foreign travel. These are all raising young people's awareness of how life is lived elsewhere and not just in their country, including more liberal societies in the West. But girls and women continue to face significant challenges all around the world. Women are typically underrepresented in power and decision-making roles. They receive unequal pay, unequal work, and they often face legal and other barriers that affect their opportunities at work. And in developing countries, girls and women are often seen as less valuable than boys. Instead of being at school, they are often made to do domestic work at home or are married off for a dowry before they are adults. So my solution in closing the gender gap is to first start within our family, because I really feel like before we even learn how to like socialize with the world and how to treat people, how we're raised in our family is very important. So I think if we address within our family, if we address and stop negative gender stereotypes within our family, and to raise our kids and cultivate our kids to respect gender roles and reinforce how to treat and respect women, such as by asking for consent for boys and girls. Oh, let me go back. While in romantic relationships. So for example, teaching your boys and your girls, your children, how to respect women and girls, for girls how to respect boys, for boys how to respect girls. So I think family structure is really important before we even go out into the world, how we're raised. And then secondly, education, encouraging and promoting education, training, and professional development for women. It is a proven fact that better education qualifications can lead to better paying jobs, which leads to a better living life. So if we encourage women to go to school more, to get training, professional training, like job interview training, like tutoring, if you have like an issue in a class, like I had an issue in a class and I had tutoring. So having that like help person to help you in a class for as a woman, I think that will really, really help women and furthering our education. And then also inclusivity in organizations and institutions, allowing women to be in leadership positions and to be heard and not just seen. So again, next one, accountability. So what in fact is, so if there is in fact an issue within an institution, going back to this one, organization or institution, if there is a problem, who or how do we handle the problem? Who do we hold accountable to readjust our goal of inclusivity? So we have to have people in power that we can go back to them and say, hey, this is what's happening and I don't like that. So I think having that person that is accountable to us and accountable to our goal of inclusivity, we can go back to them and say, this is what we want in this organization. And if you're not seeing what they promised you, going back to them and say, hey, you promised me this. You promised me that I will feel inclusive. You promised me like feeling like I'm like part of the group. But if you don't feel part of the group, you go back to them and you say, this is not happening. And then also community, forming a strong, authentic relationship among women. Women who are confined to their homes cannot join with other women to advocate for improved medical services in their community. So as women coming together and having community, like just women, like a little group, like a group chat or like a group blog where we can talk about our issues that we face as women. Because I feel like sometimes like you might share your issues, but like if you're not a fellow woman, you won't understand. You know what I mean? So having that like fellow sister or a fellow girlfriend to like tell you, for you to tell about your hardships at work, your hardships at school, maybe if somebody treated you bad at school for being a girl, having that fellow woman to like understand where you're coming from, that's very important. So that's why I included community. So now I want to talk about important women's health services that every woman should take. So the first one I have here is maternal and prenatal care. So as a pregnant woman, anybody that's pregnant, maternal and prenatal care is very important. It's as a whole, it must include prenatal services, delivery services, and postnatal services to address pregnancy and infant health and nutrition until after birth. So having a really good maternal health structure within a health system is really important. And also not to just only care for the mother while she's pregnant, but also even after she gives birth. Because I feel like sometimes hospitals or clinics would just attend to a woman if she's pregnant, but after she gives birth, they kind of like leave her alone and she's on her own, but that's not really good. So I think having that follow-up, even after the woman has given birth, to call her, to like message her, see her in person, to ask her how her baby is doing after she gives birth. So I think that continual like follow-up is really important. And then next I have promotion of breastfeeding and proper nutrition for lactating mothers. So I also want to highlight the importance of breastfeeding. That is really good for your baby if you have a baby. So I would promote breastfeeding and proper nutrition for babies. And then also family planning, having ethical and safe methods of family planning and counseling. So having someone that you can go to ask questions, whether about being a new parent, being like a new mom, because I'm sure like being a new mother or a new father is scary sometimes. So having that person that you can go to, like a mentor to help you with family planning and to advise you on how to be a good mother, a good father to your children. I think that's really important. And then also I have here breast cancer screening. So I have this sticker here on the right, if you can see the pink one, it says early detection saves lives. So I really am a firm believer in finding things before they become too bad. So having prevention and management of reproductive tract cancers, such as breast cancer, cervical cancer, as well as other gynecological conditions and disorders. So having within a health system that has prevention tests that screen women for their breasts and their cervix so that they can prevent any like cancers along the line, because I think it's really important to catch something before it gets too late. Following it's a nice invitation. Thank you. Yes. And then I also included mental health and violence survival service. So I think it's really important to also, I feel like people tend to forget about mental health. We're always focused about physical. As much as physical health is important, we also need to talk about what's happening up here. So sometimes we feel sad, sometimes we feel like anxious, but we don't know why. So having that professional, a mental health professional that you can go to express your feelings, express how you feel, maybe like you don't know how you feel, maybe you're having a bad day, but you don't really know why, or you're having thoughts, like bad thoughts. So having that person to go talk to, because I don't want us to just have these thoughts and keep it to ourselves. It's good to speak out how you feel and to have a listening ear. So having a mental health resource is really important. And also stopping domestic violence. Women suffer like one of the most from domestic violence. So I think having within the health system, mental health and domestic violence services to help women is very important as well. Let me see the chat. Kenya, nice. Okay, so now my presentation was geared towards women in the beginning parts. So now I want to focus on the men. So I said here, what can men do to help women empowerment? Because sometimes I feel like men tend to feel a bit left out of the conversation. So they're like asking, well, what can I do? I'm a man. What do I do? Like, this is not for me. This is for you also. So what can men do?
1 minute, please. Today, when I share the conversation in the WhatsApp group, someone asked that question. So I'm a man. What would I do?
Okay.
Thank you very much for including this.
Yeah, I get this all the time. People always say like, well, I'm a man, what do I do? So how can men help in women empowerment? So to become an ally for women empowerment is to realize the complementary of both genders. So women empowerment is not about like, it's not this or this, it's together. So it's women empowerment is not to say that men are less than women. It's not to say that like women are better than men. We're all in this together. So it's to understand that we're a team and we're working towards equality for everyone. Nobody is better than anybody. So I think that's really important to realize that. So realize the complementary of both genders. And the reality is that about the relational dynamics, the beauty of life is in the interaction between elements. And so men and women must understand how both roles are indispensable and deserve to be respected and honored. So I think that's a really important beginning step, understanding that both men and women they both need to be respected and honored, but also knowing that we're not against each other, we're working together as a team. And then secondly, I also said by listening and helping a woman's idea grow. So if you have any women in your life and she comes to you, for example, with a business plan, or I want to start braiding hair, don't just like dismiss her like, oh, be quiet, like, oh, no. Like helping her and her ideas and her vision, help her ideas to grow by being perspective and listening and providing ideas and perspectives. By acting towards her the way we wish the world acts towards her, with respect, honor, and kindness. You empower her when you can contribute to her success and her humility. So contributing, you ask her, how can I help you? That's how I would say a man can help in women empowerment. Not just like staying on the sidelines, but being part of the conversation and saying, okay, I've heard your ideas, I've heard your vision. Okay, how can I assist you? Being available will be a really good way that men can help in women empowerment, being available. So now I want to focus more on more of a like action reality, because I'm a very like practical person. So what I want you people to get away from this like meeting today is I want you to pick out of this 6 issues that I listed here, major health issues in Africa. I want you to pick out of the 6, 1 or 2 or 3 of like issues that stand out to you that you would want to fix. Because I think like it's hard. Sometimes you have a goal, but you don't know where to start. So that's why I included this part right here, knowing where to start. Kindly, I'm being social worker. I'd be glad if you could have shared training manual, please. Okay, I don't know about social work, but I can help you. So major health issues in Africa. Number 1, I said health payment system, having to pay before receiving treatment. That is one of the major health issues in Africa. Like people like in the US healthcare system, when you go to the hospital, you don't pay before they treat you. You get treated first and then they bill you a payment. So I think that's something that has to be changed in Africa. Personally, I think so, because if somebody is going to the hospital and they're about to die, like their life is more important than money. So I think being able to treat them first before and then they pay you. So health payment system, that is an issue in Africa, I think. And then also quality of drinking water. There are a lot of countries in Africa, even Nigeria, where I'm from, that we don't have quality of drinking water. Like in the villages, they don't have quality drinking water unless you go to the city. But in the villages, so I think that's a really serious issue. And then also infectious disease, like Ebola that happened in Africa, coronavirus now that's in COVID-19 that's in Africa, epidemiology. So if you're interested in infectious diseases and treating people with infectious diseases, epidemiology is the public health classes that you have to take. And then number 4, I have here hunger and malnutrition. So malnutrition is another big issue in the whole continent of Africa, even in Liberia and Nigeria, like all over Africa. People need food, people are hungry. So how do we fix that? Hospital quality improvement. So the hospitals, I know for personally in Nigeria are not good. Like you have things falling, ceiling leaking, and there's not enough bed, or like people are like in the hallway, people are like, they don't have enough like beds to put people. So hospital quality improvement is another big issue in Africa. And also number 6, HIV, AIDS, and sexual education is another big issue in Africa. In our country, Kenya, the government has put in measures to provide free maternal health care. Oh, that's nice. I wish Nigeria did that. But yeah, that's good. Kenya is doing a good job, honestly. Kenya and Rwanda, they're doing a good job when it comes to public health in Africa. Other countries need to follow Kenya and Rwanda. But yeah, so that's another thing that I put here, HIV, AIDS, and sexual education. So these 6 issues, I think are the 1, 2, 3, 4, 5, 6. I think if we can handle these 6 issues in Africa when it comes to public health, we're doing a good job. So I think so we can write down these 6 things and pick 1 or 2 that you really are passionate about, and then you can go after it and try to fix it, whether it's through school, whether it's through politics, whether it's through policy, like being in a leadership position, whether you're a man or woman, a child. With these 6 problems that we have in Africa, we can make a difference. These 6 things I think are really a good starting point. So conclusion, I said, I included a quote by Malala. She says, "I raise up my voice, not so I can shout, but so that those without a voice can be heard. We cannot succeed when half of us are held back." So I think understanding that, like I said, it's not, women empowerment is not man versus woman. We're not fighting, we're together. So we cannot succeed if women are far behind. If this is like the man succeeding, and the woman is too far behind, we're not succeeding. We all need to be on the same page, and we all need to pull each other. If I see you falling, pull you up, and we all need to come up together. So we cannot succeed when half of us are held back. So I think that's really important in women empowerment. Sex issues are very critical in the moment in our continent. There is a need to provide a revised legal framework on this issue of sex. Yes, definitely. And I think that's where it also goes to the HIV and AIDS education. Yeah, for sure. So yeah, I think you should write these down. These 6 issues are serious things in Africa that need to be addressed. So I think this is a good starting point. If you want to go into public health, policy, politics, this is it. This is important. So yeah. And then this is my public health page, Public Health on Demand. And my LinkedIn is Favor Obasiolu. So you can go on Instagram and search Public Health on Demand, and then you can follow my page. And on LinkedIn, it's my name, Favor Obasiolu. That is all. Any questions? This was fun.
Thank you very much. So the question Inosh asked was, she was asking if you will share the slide with us so we can share with them.
Yes, I will.
We should talk about the training manual. So if you have questions, you can just raise your hand. We will unmute you and you can ask your question. or if you have any suggestion, question, suggestion, anyone.
I like this one. Somebody, Ali said, in Africa, the majority of the population are young, hence the need to focus on adolescents' health. Yes, definitely. Yes, I researched online and I noticed that like Africa as a whole continent, we are the like youngest people, but we have the oldest leaders. So there's a disconnect there. We need young people to stand up and go into leadership because they know what we're going through because they're young like us. So I think that's really, we need to focus on the youth in Africa, which is why I love this organization because the youth are the future. We are the future. You can also type questions in the chat too.
Yeah, you can write your question or just okay. You can unmute yourself.
Well, good evening, everyone.
Good evening.
But this is Kimameti Enoch from Kenya. Professionally, I'm a social worker and a community development graduate. And actually, in regards to the session that we are tackling at the moment, this is very critical in when it comes to health, maternal health care. And the issue that has actually prompted me to pause is on the issue of sexual abuse. You know, at the moment, young men and women are engaging themselves into sexual activities without understanding its context. So it's very important. We as young generation of the African young generation, that we wake up and then instill the sense of understanding at the youngest age. You know, at the youngest age. Like for example, if we can involve the government institutions in providing a legal framework in regards to sexual protection against this among the adolescents. Like for example, in our country, since last year when COVID-19 came up, so many young girls have become pregnant, and this is due to lack of information. But if we can stand up and then we as young generation of Africans of African continent, we can stand up and then instill this sense of understanding the values that and the importance of having having a sense of understanding in regards to the sexual issue. I think it will be very better. It will be better the lives and the health care of the young generation. Actually, we are losing moral values because young people are losing do not have the information. Yes, we could be having information now, but if we have the information but we are not sharing it, we are not engaging these young people on various platforms, perhaps in various institutions, we team up. Like for my case, I've come up with a group, Youth for Youth Empowerment Program. You know, actually we are moving across the community, empowering young people in schools, primary and secondary schools, to understand this issue of adolescence and how to manage the sexual abuse among the youth. So it's very important. And Madam Favor, I really want to thank you so much for providing this session. And I think it has added more knowledge and experience to on my profession. And I really applaud you on this. So let's continue, ladies and gentlemen. Let's continue ensuring that we bring on board this issue. We address this issue, including involve our parents, we involve teachers, we involve all levels of professionals, so that when the young people grow up, they understand at what stage they are supposed to involve themselves in sexual issues. Thank you so much.
You're welcome. Yes, thank you for including that. That's why I really added that for number 6, because I feel like that's something that people try to like hush, like don't talk about it, don't talk about it. But we need to talk about it. It's really important. We can't keep quiet because it's happening. You know what I mean? So we can't say, oh, it won't happen. They're children. No, it's happening. So yeah.
Thank you very much. I think there are some questions in the chat box. Just, just a suggestion. If you guys want, at the last day of the training, we can divide you into groups like we did yesterday, and then you will choose one topic from these 6 problems and write a project in your group. You discuss it and write a project, a solution to these problems. If you guys want, we can do that. It will be very good, a group work.
Okay. Somebody said keeping girls in school to continue their education beyond primary school will definitely help in addressing GBV issues and also in return help in empowering women. Yes, I agree. Education is very important because like if you just like don't really like go out and get an education, you don't like socialize with people. Even in school, you learn skills on even how to talk to people, how to socialize. So I think education is very important. Girls need to go beyond primary school. We need to go to university. We need to get like our degrees in Africa. Girls in Africa, Nigeria, Liberia, Cameroon, that's an issue. We need to go beyond primary school. And then also somebody said, I must really appreciate you for the presentation. The payment system in our healthcare system, we prefer collecting money from patients before treatment, which of course, when it comes to health, like medical ethics, your first priority is the patient care. Exactly. I learned that in my ethics class. I took a public health ethics class and we talked about that. Like, do you see a patient about to die or are you worried about money? You know, like that person's life is a lot more important. So I think fixing in Africa health payment system, having to pay before receiving treatment, I think that needs to change. Somebody's life is more important than money. This is one key issue affecting us in Africa when it comes to the mortality rate. Exactly. Yeah. So health payment system, if you fix that in Africa, that's a big achievement. Yeah, for sure. So I think it's really, what I love about public health is that public health really, like there's so many different parts of public health. Like you see how under the whole umbrella of public health, there's health payment, which would be more economics. So if you have a public health degree, you can even get like a second degree in economics. So then you can focus on health payment. And then if you have a degree in public health, you can focus on epidemiology. So fixing like diseases like Ebola and things like that, and like vaccines, things like that. So I think within public health, there's so many different like economics, law. That's the one I like, law, public health plus law. That's really a good combination. In Sudan, we introduced life skills-based education as part of the curriculum to address HIV/AIDS and also to introduce culturally sensitive sexual education. Oh, wow, that's good. I like this conversation. Let's keep it going. Also, another thing that I think people need to have more conversations about in Africa is mental health. That's why I included this here. This one, yes, mental health and violence survival. I think mental health is really, really important. We haven't talked about that enough in Africa. So I think that's another issue. Having psychologists, psychiatrists. So like I have a minor in psychology, which is studying people behavior and the way they think. So yeah, mental health and public health, they're like this. Mental health, public health, they're together. Thank you so much for the presentation. It's really educative. What are some of the steps you think should be taken in order to end hunger in Africa? Oh yes, hunger in Africa. That's a good one. Oh wow. I would say there's a system in the US where people that don't make a certain amount of money, like you have to, if you make below a threshold of amount, that the government gives you like food stamps. So like they give you money to go to the grocery store, the market, to buy food. So I think if we can incorporate that system in Africa, like if you don't make a certain amount of money, that the government will be responsible for feeding you, even if it's not the best, like, you know, like Thanksgiving or like a big meal, but like being able to eat two meals a day, everybody in the whole like country, I think the government should be responsible for that. just like in the US, that we have that system in the US. So I think if we add that in Africa, that would be really good. So again, it goes back to budgeting, economics, budgeting, things like that. So like,
Okay, Ali, you can ask the question now.
okay, Ali, you can go ahead.
Hi. Recently, I worked in Pakistan, and one of the very interesting things around GBV, gender-based violence, that struck me that they have issues of sexual abuse among boys. You know, that's part of the world has a different dynamics. And interestingly, some of the organizations like UNFPA cannot address this issue because, I mean, the way they built their setup is just around women's survivors. They never thought of this part, and it became a real challenge. I'm not sure if this is the case anywhere in Africa, but this is another area that of public health on how to address this. And this is also gender focused, because sometimes people, they think of gender is only women.
That's true.
So if you have ever got anything to help in addressing this as well, yeah, over to you.
That's true. Yeah, that's really important, because I think a lot of times when we think about gender, like violence, like domestic violence, it's mostly women we think about first, but men also go through domestic violence. So yes, I think when people seek help, I've heard, I don't know if it's true, but I've heard that sometimes if it's like a man that's seeking help, they're more likely to turn down the man. They're more likely to say, oh no, like you're like, you don't need help. How can your wife be hitting you? You're a man, you know? So I think that's not good. So I think being inclusive, if a man needs help from suffering from domestic violence at home or sexual assault, I think having that listening ear to not just dismiss them, because we always see men as like strong and women as weak. That's not the case. So I think men also go through domestic violence, sexual assault. So having that like open-heartedness to accept everybody, not just women, everybody that goes through sexual assault and domestic violence. Also having shelters, like domestic violence shelters. I know in my city here in the US, like in the city downtown, we have shelters where people that experience domestic violence can stay. So they have men and women that live like in that shelter. So because living at home sometimes is not safe, because that's where the violence is happening, at home. So leaving the home where the violence is happening, or anywhere where the violence is happening, and going to a shelter that can house you and feed you, that's really important. So making shelters, domestic violence shelters in Africa. It's an opportunity today to be part of this training. Liberia, many of our youths are mentally ill with no care from the government to them. That which has become one of our major issues, but through my investigation in Liberia, the causes of the mental illnesses are due to addiction to drugs. That's another one. That's a big, yeah.
They even give the name, they call them Zogo.
Oh, really?
Yeah, they call them Zogo.
Yeah, drug abuse is also a huge issue in America. Drug abuse. So yeah, that's important. Yeah, mental health, drug abuse, and sexual education are the three. Mental health, drug abuse, sexual education are the three like things to mention for young people. I just feel like there's just so much to be done, but like, I don't know, I just feel like no one really cares. Like we need to care. Like we have so much work to do. Kindly share the slides.
So we have MD from Bangladesh. We have Iman from Pakistan. We have people from almost every part of the world here with us.
Yeah, that's great. You can also ask more questions. I'm open. I have like 30 more minutes, so I'm free. Does anybody have any questions about this part? What can men do to be an ally to help for women empowerment? Mhm. In Liberia, our health system is very poor and the health workers value money more than the life of a patient. I would like to encourage the youth to come together and make this organization better for the future generations. Yes, yes, for sure. It's funny how we keep mentioning the health payment. I think that's number one. If we can fix the health payment system in Africa, that will really help.
Like
Africa,
recently, there was a boy that died because of this series in Liberia. He fell from a tree and his hair got stuck in an iron, a very long iron. So they took him to the hospital, and his family was told to pay for blood before they could test him, and they never had the money. It took him almost 3 hours, and he didn't make it. He died.
yeah, yeah, that's the same thing in Nigeria. You have to, in order for somebody to like do a surgery, you have to go and buy your own blood, buy your own needle, buy your own syringe, buy like the hospital. Like, am I not at a hospital? You should have all this here, you know? I think really like having these things in the hospital so I don't have to go out and buy it before I can get treatment. That's important.
All right, you Jay, you can ask a question.
Uh, Once again, I'm UJ Elsewhere. I'm from Liberia and one of the member of the Public Health Foundation of Liberia.
He's the
First of
national
all,
director
I
of
want
the
to be very grateful
organization.
to the presenter for the presentation. It was actually splendid, it was good, and it was inspiring, educative. Another thing we need to look at when it comes to the female is menstrual education. We found out that another thing that is bringing or teenage pregnancy or the increase in teenage pregnancy is menstrual or education. Our girls or our female are not actually educated or to the level when it comes to their menstrual cycle. So you find out that when they get into life, they just go about doing what they think is good for them, not knowing it can actually affect them. That's why you see teenage pregnancy or or young girl having a child before the needed age or the age you should have that child. So these are things also we need to take into consideration to improve our health system. Because if these things are not improved in our country, we find that it will be very difficult for Africa to move forward. Like another thing, the payment system when it comes to treatment of patient. You know, when it comes to medical ethics, your sole priority is the patient. Everything you do is the patient. That's why even your phone, once you are on duty, you don't have to touch your phone until off duty because the patient health is very important. But what if the person is actually bleeding severely and you tell the person they need to pay before treatment and the person that what actually will you say or what actually will you tell the person? That's why as for me, one thing I want to engage into, I want to be a medical lawyer. Yeah, because these are things that actually affect our people and increase the death rate in our country in the end either put on different disease or whatever because the health workers are also they do malpractices that affect the patients. So I want to be very appreciative for your presentation. It was actually educative. Thank you.
Thank you. Somebody asked here, so I see two questions. Let me answer this one first. So how can one become an ally in order to help women empowerment? So this is this slide. So I think I said here by listening and helping a woman's idea grow, by being perceptive and listening, providing ideas and perspective. So I gave the example of like your sister or your mom or your friend that's a woman. She comes to you and say, hey, I want to start a hair business. I want to be braiding hair. So I think most people, most like people would like shut down the idea. They say, oh no, that's nonsense. No. But I think like listening to her idea of starting a hair braiding business, for example, or she wants to go into public health, she wants to start school. I think listening to her idea and giving her perspective and like helping her in her goals, that's how men can be allies. So not just like ignoring women when they talk, saying, oh, that's a good idea if it is a good idea. It's important to be honest and to share your advice, what you think. Like, for example, if you don't really agree with the idea, you can say, oh, maybe we can do this instead. But don't just like completely ignore the woman or shut her down or like just be rude to her. But I think being like honest and being receptive, listening to her idea, giving her more ideas. Maybe she didn't think about something. You say, oh, did you think about this? Did you think about this? So I think that's a way that men can be allies, working with women and not just shutting them down or ignoring them or like putting them to a corner. Oh, no, you stand here, you stand here. No, I want to be in the front. Let's both be in the front, you know? So that's to answer your question of how men can be an ally. Teamwork. So somebody, Ebenezer, said, what can African youth do to improve the health system of Africa through reality and not just speaking about those issues? So that's what I have here. So major issues, that's why I added this slide, because this is to make things more realistic. So like wherever you're living, in the community that you're living, if your community is having issues with these things, think about ways that you can solve it. Most of the times, I think people wait for like change to happen. There's this quote, I forgot who said the quote, but they said, be the change that you want to see. So instead of just like sitting back and saying, oh, like there's this issue here, there's this happening. No, like don't just sit back, go in and say, how can I fix it? So putting yourself, that's the realistic way to answer your question. You said through reality, putting yourself in that mix in position of leadership, position of decision making in your community. You can have like, if there's a community like leader, you can talk to them saying, I've noticed this issue in my neighborhood. Girls don't have education for sexual health. Girls don't know how to like menstrual cycle education. They don't know how to take care of their menstrual cycle. Like if you see issues in your community, be the one to initiate the change. So I think that's what people need to do and not just wait until, because if we keep waiting, sometimes it might never happen because our leaders, I don't know. I don't know what's going on, but I think being the change that you want to see in your community, be the one. You're the answer. So to answer your question, you're the answer. That's what I'm gonna say. Having organizations like this that teach people, you're the answer. With the issue of empowering women in my country, Liberia, many female mostly are not interested in involving themselves to learning due to fear, lack of confidence. So now my question is, what can we do to help empower women in Africa easily, especially in Liberia? Our females today choose to stay away from learning just to be in the street in Liberia. So what can we do? Like you mentioned, out of fear or lack of confidence. So I think it'll take time, but if you have like, for example, any close female or girl close to you, like your sister, your mom, your friend that's a female, constantly telling them that it's like they need to like go to school or like education, healthy living, things like that, that increases their confidence. It's not going to happen overnight, you know, it'll take some time. So constantly repetitively saying, oh, how is this going, so what are your plans next? Do you want to start school? Do you want to look for a job? Do you need help with your interview? Do you need help with your resume? You know, put like, what do you call it? Professional building. Do you need help with me to help you go look for a job? So involving them, it might not happen overnight. Like I said, it would take some time, but not to give up, especially if the person is close to you that you can talk to them. If it's like a stranger, that's kind of hard. But if it's like somebody that's close to you, like your sister, your friend, your mom, you can talk to them constantly to build their confidence, because it doesn't happen overnight. It takes time. So that's what I would say. What is the best quality of drinking water? The best quality of drinking water is water that is more on the base side. You know how there's 7 is neutral and 0 is like really acidic? So water that's more on the base side, that's more like on the 7, 8 kind of range, that's water that's drinkable. So water that's like in the stream, that's not drinkable. Water where people wash their clothes, that's not drinkable. So another thing, somebody asked about how we can like in reality make these things happen without just talking about these issues, but being realistic. There's somebody in my country, Nigeria, that they built, do you people know what borehole is? Like a drinking hole fountain in a neighborhood? Do you people know what that is? Like where people go and they fetch water.
Yeah,
Yeah.
it's everywhere in Liberia.
So there was somebody that I know in Nigeria, he built that in his village. So that's being very realistic. That's affecting the quality of drinking water, because we can't be drinking the same water that we wash our clothes inside, you know? So that water is not clean. So building like fetch water borehole where you put your bucket to bring out the water, he built that in his village in Nigeria. So I think that's really a good example. Another thing we need to do in Africa is that we need to include health education in our curriculum for both primary. Yes, that's true. Yes. And even if it's not even if it's not the most complicated like health thing, but it's just the basics. So again, so this goes back to being realistic. So in your community, who makes the school curriculum? Who's in charge of making the school children's books? Who makes those books? Like, so finding out things like that, saying, okay, I've noticed that in our school books here, the children they're not learning about public health education in their school, but I want them to be able to learn. So you talk to the principal, the headmaster of the school, you say, this is an issue. So being realistic and actually going to the problem head on and not just beating around the bush, but heading on the problem, going to people in leadership, asking them questions, asking people questions, holding them accountable, the headmaster in the school. So how can I make sure students in this school, in my community, are learning about health education? Things like that. What your organization doing to help Africa deal with those health issues? So I don't have any organization like this. This is amazing. I just have a blog because I'm a public health professional. So I don't really have any organization like this. One day, by God's grace, I will. But as of right now, I have a public health blog. So yeah, so I just go and give speeches and speak to people. But one day I definitely want to create my own organization just like this. This is amazing. What COVID-19 has broken down improved healthcare system across the world. What African doctors are doing to help close the gap for future occurring health infectious disease? Oh, I don't know. I don't know what African health doctors are doing. So another thing, I also want to like I said, master's in public health. I want to go into global health. So I think that's when I'll be able to answer more of these like global health questions, but for sure. I want to have my own organization where I can go back to Africa and help people because these issues they need to be fixed.
I have a question.
Mm-hmm.
If, for example, I study other subjects other than public health in my undergraduate, can I do public health as master's?
Yes. So I don't know how it is in Liberia or even in the whole of Africa, but I know in America, you don't have to major in public health to do masters in public health. All you have to do is take an exam and then apply to the school. But I don't know how. You have to ask your particular school that you want to go to. So yeah, whatever country you're from in Africa or anywhere in the world, you just ask the school that you want to go to, do I need to have a public health bachelor's? But in America, no, you don't have to have a bachelor's in public health to do master's. I want to do my master's. Can you give a public health talk to public health students in Uganda? Oh, sure, but I don't know how am I gonna get there? I would love to. But yeah, travel and COVID-19. I would love to. So yeah. Oh, question.
You can talk now.
Hello.
She raised her hand. Yes.
Can you get me?
Yes, we are hearing you.
Um, yes, I'm Newton from Uganda. If she can give a public health talk to public health students who are doing bachelors in Uganda, we have an association that it brings together
Oh, we can't hear anymore.
Yeah, I think he's having internet problem.
all the students who are doing public health in Uganda called the Students Association. So it's about public health. And those students, really, she can connect with me because I'm the president of that association, and we also prepare and have a talk with her via Zoom. Thank you.
Well, we didn't understand you fully. So if you can change your location and talk again or just write in the chat box, that would be better.
I was saying that I'm Newton from Uganda, the president of the Federation of Uganda Public Health Students Association. It is an association that brings together all students who are doing public health at the bachelor's level. So I was in give us as a profession and other areas of public health and the way she has given to us and more other issues because me I'm the president of that association, so we can easily link up and we prepare that network that could also help the public health officers that are in training who are the students now.
Okay, I get it. Yeah, you can reach out to me. I can type my email here for you. This is my email. Somebody asked any opportunities for scholarships for PhD in public health. Will you be schooling in America, US, or Liberia, or what country, or Kenya? But I know in the US there's scholarships for a PhD, but I don't know how it like will translate to Liberia. But I think you can ask the school that you want to go to. I'm sure they'll have scholarships. But there are definitely scholarships for public health. There are a lot of scholarships. I'm studying geology at the University of Liberia. It is advisable to do my master's in epidemiology. Oh, is it advisable to do my master's? Are you studying geology in your bachelor's?
Yeah, I think that's right.
Yeah, you can do any degree in bachelor's and then just go into public health for master's. And if you love infectious diseases, that's epidemiology. For me, epidemiology was a little bit hard for me. I took a class of university epidemiology. It's a lot of math and like statistics. So if you're good in math, epidemiology is good for you. But I like policy and law. The right to use yes. I'm doing bachelor in science and public health in Uganda. Oh, that's great. That's so cool. I love public health so much. I love public health. Growing up, I've always been about like change and like helping people. Even when I was younger, I always used to say like, oh, like I don't like how this is happening in this village. Because I used to live in Nigeria before I came to America. I would tell my parents like, I don't like how this is happening in this village. We need to change this as a small child, you know? So I've always like had that passion to like help people. And like whenever there's an issue, I have to fix it immediately. So I think we shall connect via your email. Okay, great. My email is right there, f.obasiolu@yahoo.com. I have about 5 more minutes.
All right. In the 5 minutes, I think we can all take photo. We will love that.
Should marijuana be illegalized because it has affected many people? That's an interesting question. See, that's where public health ethics comes into play. Because in my ethics class, we talked about legalization of marijuana. So in America, there's something called medical marijuana. So there are some diseases and things that actually require marijuana for treatment. So in America, if it's for medical reasons, it's legal, it's fine. But if it's not for medical reasons, it's not good. So only if your doctor prescribes you for medical reasons. But if it's not for medical reasons, marijuana, I don't know, it should be legal. How
All right,
can
guys. Okay. All right. We are listening. Sorry for cutting you. You can continue.
somebody asked how to get influence health policy for change in Africa? I would say by connections, making connections. Because sometimes in this life, it's good to go to school and all that, but sometimes in life, it's all about who you know. I've come to realize that. So making connections. So you meet these people in school. For example, I've met classmates now that they're going into policy or politics. So like all about connecting with people, going wherever you see any public health event happening, be there, go there, talk to people, introduce yourself. Hi, my name is so and so. I'm public health professional. Put yourself out there. That's how you get to know people and get connections. Okay, I think that's all.
Okay. Thank you very much for such an educational session. I learned a lot. And we are very glad that you accepted our invitation. Thank you for being here with us. So if there are no other questions, we will just take some pictures. So if you have a very good background, just open your video. If your background is not good, you can close it, no problem.
Okay, let me take my picture too.
We'll share the pictures with you too. All right, let me see if I can be mine too. Okay. And again, we'd love to apologize for the mistake in our town conversion. That's why we have so less people here. We are sorry for that. I guess we have to work on that for tomorrow's session. So thanks to our presenter for excellent presentation. And I guess we all had the opportunity to ask our questions. If you have further questions, you can follow her on Instagram and you can text her there, or maybe you'll find some Instagram post that will answer your questions. I urge you to do that. It's very good. That's where I got her from. Just to let you guys know, I've been following her page. When I first got interest in popular health, I just went on Instagram, check for all the popular health pages, and just follow them for educational contents. So you can do the same, and you'll find some that are interesting, and you'll learn from them. So if you have any comment or thank you for her, you can just unmute your mic and say just 3 seconds, please. She has to go. And then thank you or comments, you can just unmute your mic and say the thank you. Or just raise your hand and open your mic. Okay, Ebenezer. 3 seconds, please.
Oh, yes. Kahuna Barry.
Yeah, thanks very much for the presentation. We really enjoy it and we learn a lot. Even though I observe many people are not wearing masks, and this is health problem.
No, I'm in my house. Yeah,
No,
outside.
but some people.
I'm in my house.
Thank you, thank you.
All right, anyone else?
Okay, thank you very much. Thank you very much, Phil, for that brilliant somebody has to carry that message across in the community.
All right, thank you, Ebenezer. Didn't get you. Take Princess. Princess, just look at your phone and unmute yourself.
Okay, thank you very much, Miss. And I know a lot, but there's something that we did not discuss, and I hope we'll get a chance to discuss it. Some of the environmental health is another major problem, so I hope we discuss that next time.
Yeah.
Thank you.
Environmental health. I think so.
Environmental health is important.
All right, if there are no other questions or comments, no problem. We will stop here for today. Everyone for attending, and we apologize again for made mistake in.
It's okay.
All right, ma'am. Thank you very much. We'll see you on through the email or on LinkedIn.
Thank you.
Thank you.
Bye.
Bye. All right, guys. Thanks to every one of you for attending. We are very much glad, and we again apologize for the time missed up. We will try to work on that for tomorrow. So we share the photos of today's training in Facebook and also in the WhatsApp group. And if you have any questions, feel free to ask your questions in the group. We'll try to answer them as possible as we can. If you have any suggestion, for example, we made a mistake somewhere or there's something we did you don't like, you can let us know. As you all know, we are just young people. Some of you are ahead of us. Some of you are masters and PhD, and we are just undergraduate, and we are young people running this organization. So we are open to mistakes, to errors, and sometimes we do something that we don't mean. So if you have any suggestion or anything, just let us know. Lastly, we've developed our online website. So for those of you that are interested in this online, you can visit our website in 1 month time. There will be courses available. You just log in, open your account, and find the course of your choice and take it. For those of you that are doing masters and PhD in public health, wheresoever you are from, any country you are from, you can also become instructor on the website. You just let us know. We'll open an account for you, become instructor. You'll be making courses, and every money you make from the course, let's say the course is $5 or $2, you are selling the course. So the money will go to you. We don't want any part of the money. We'll give your money to you. If 10 spend at 10, every month we'll send your money to you. But we don't want the courses to be too expensive. So if you are interested to become an instructor, please also let us know through our email, and we will work towards that. So thank you all for attending. If there are no comments or questions, we can leave for today. Yes, Haruna? Yes, Haruna. You can unmute yourself, please. Haruna, please unmute yourself. I'm not getting you. All right.
Yeah, thank you very much. Well, for the time issue, it was mistaken for Labrosa. So at least tomorrow, next section should be rectified.
All right. Thank you very much for that. We'll do that. Tonight, we will share the information with you about tomorrow's session. Please attend. We beg you, please. So any other comment or suggestion? We are done already. So if you have other things to do, you can leave. Today's session is done. Um, we have MD Umar Farouk from Bangladesh. Welcome. And others were with us, but they went out. So you're all welcome. We are so much sorry for the time mess up. Yeah, we are so much sorry.
Can I know your name, please?
My name is Musa Al Hassan Kroma.
Thank you, thank you.
Don't worry, you get to see me more often. We'll always be here with you. So like I said earlier, she gave us 6 health problems in Africa. If you guys are interested, we can have a session where we divide you guys into teams and you work on these 6 problems and see how best we can find some solution to it, like a project, a short project development, like maybe like 1 day, or maybe we can do it for 2 days. You work on it and come up with a solution to them. Let's say team 1 will choose the first problem, team 2 choose the second problem, and you guys will work on it to try to find solutions to it. And then we take the best 2 projects, the best 2 that have the best and achievable solution, and we can implement them in Liberia or any other country that will be able to implement them in. So, Lucina, we are sorry you came late. We are done for today. And we are sorry for the
certificate
time.
will be after the program, right?
Yeah, the certificate will be after the program. Now we are working on it, so we'll make sure like maybe 2 or 3 days after the program, you get a certificate. And for the certificate, you can go on our website at any time and confirm if so you don't have to worry. We will send you an email, and we'll also send a link in a WhatsApp group where you get it from, because we observe that most people have a problem with getting it from that email. So I'll probably be at the end of the training, we will have a session to show you on how to get a certificate, because you have to use the code to be able to download it, the code that was sent to your email. So if you don't know how to do it, it'll be difficult for you.
And I heard you guys saying that there'll be a wedding people for active members.
Yes, those that attended actively will be awarding them. Now we have just 3 persons on the list. Not just to attend, we want people that will ask questions, that will interact with the facilitators. So now we have 3 persons on the list, and we'll see if they maintain it for the next sessions, then they'll be awarded.
Well, I want ask, is it interactive like voice or writing?
No, we take the writing to consideration also. What are you asking question in message, in the writing, or your voice? We take that into consideration. Don't worry. So in 2 days' time, you can find this session recording on our YouTube. But now it's on Facebook, so you can find it there also.
So what's the WhatsApp name?
You're in the WhatsApp group?
Yeah, not the WhatsApp, but the Facebook name. It's in Public Health Foundation of Liberia.
Yes. All right, guys. We can all go down and get prepared for tomorrow's session. Thanks to every one of you. Haruna, Iman, Kaifara, MD Umar, Rosina, Doi Kim Lebo, thanks for coming. Samilia, Do, thank you. UJ, our National Director of Popular Foundation of Liberia. Thanks for joining us.
Thank you very much too.
They went out.
Even though I was unsure of seeing your face, but today I saw your face. But yesterday only your photo was there.
Don't worry, I'm not. I'm not.
So which project for?
I'm a Liberian, but I currently live and study in Turkey.
See you tomorrow.
All right, guys, I'm ending the meeting now. See you guys tomorrow. Bye.
Bye.
Bye.